it's a fallacy that the public is that interested that they want to become, an expert in your topic area.
But my science is the most interesting.
Hello, everyone, and welcome back to People, Parasites, and Plagues, a podcast aimed at delivering information about the fascinating pathogens among us from the scientists who study them. I am Kim Klenowski.
And I'm David Peterson, your host for today's episode. George Bernard Shaw once said that the single biggest problem in communication is the illusion that it has taken place. Today, we'll talk about what it takes to make good communication a reality.
Our guest today is Dr. Glen Nowak, a professor in the Department of Advertising and Public Relations and director of the Center for Health and Risk Communication at the Grady College of Journalism and Mass Communication. Dr. Nowak has a broad range of experience in managing and implementing health and risk communication programs, media relations, and health information campaigns. Glen, welcome to the podcast.
Thank you. Thank you for the invitation.
So, Glen, you were trained in communications, University of Wisconsin in Madison, I believe. And it seems like that was kind of from a marketing perspective. So what attracted you to science and health communication?
Well, I actually thought I would be a journalist. And so my bachelor's degree is in journalism. And that was from the University of Wisconsin-Milwaukee. And it turned out that there weren't many journalism jobs back then. And they didn't pay very well. So a friend of mine persuaded me to go to the University of Wisconsin in Madison and continue my education. And I still thought at that point I probably would be a journalist, but I got interested in persuasive communications as part of my graduate studies. And then I was persuaded to stick around and get my PhD. And my focus really did shift to how do you get people to do things? Why do people do things? How do they process the information that is being sent to them through all these various channels?
Well, there seems to be a little psychology in that as well, maybe.
Quite a bit. So a lot of my courses were in consumer information processing. Marketing was another big part of it. Looking at mass communication theories, how do people respond to different ways to persuade them? Getting a really good sense of how hard it is. A lot of times people think that if I just give you information you don't have, that you will suddenly look at that, read it, understand it, and change your mind. And that may happen, but it rarely happens. And most times, if we're trying to persuade somebody, that is somebody who has a different opinion than we do, it's a lot harder than we imagine. I think we get fooled a lot of time because we think we're doing persuasion when in fact we're actually talking to people who already agree with us.
So I think that goes back to the George Bernard Shaw quote.
Yes.
So how did you move into the public health realm? Can you talk about that journey?
Pretty much by accident. I took a job at the University of Georgia in 1989 as an assistant professor of advertising. And it turned out that one of the people who was on my dissertation committee at the University of Wisconsin had been working with some people in communications at CDC who were in their division of HIV/AIDS. And they were trying to improve their public service announcements for the HIV hotline. And it turned out that when I did my dissertation research, I was using ads that had 800 numbers in them, similar to what CDC was looking for in terms of their HIV hotline. And so he introduced me to some people at CDC, and we had a lot in common in terms of their project. And so I did a visiting communication scientist stint with CDC, and that led to me doing probably about 4 or 5 more of those over the span of my 9-year career here at the University of Georgia from 1989 to 1998. And they were all in HIV/AIDS, and they were all had communications as a central theme, but they were all quite different. And so some of them were testing messages with people about HIV/AIDS prevention. Some of them were going out to communities and having town hall meetings, talking to them about how they thought CDC dollars should be spent in their community. And then the last one was a giant entertainment education project where we brought over 200 13 to 19-year-olds to Beverly Hills, and we connected them with the entertainment industry. So some of the actors and actresses from the show ER actually participated in that project. And we spent 3 days doing workshops and trainings to help these young people who were doing entertainment education initiatives or projects to try to prevent HIV among their peers to give them some additional skills. And then shortly thereafter, there were a lot of programs at CDC that kept asking me, would you ever apply for a job here? And so I did. And I became the director of communications for the National Immunization Program in 1998.
So one of the things I find interesting is, I guess, thinking right now about the AIDS projects you did. There was messaging to address, I guess, specific concerns of the public. And how do you figure out what the concerns of the public are? Is it just based upon, as you said, the 800 number of folks were calling, or town hall, or a mixture of things?
Well, I think one of the things that people don't realize is that we rarely have the public as an entirety as a target audience. And if you tried to do the public, I don't think you'd find you'd have the resources, the bandwidth to do the public. So very often you have to decide, who is it that we need to reach? Who is it that we need to communicate with? Who is it that needs our services? Who is it who needs our advice? And when you go through that exercise, you find that it's a much smaller group than the general population. And then at that point, you're better able to figure out, okay, if I'm going to try to persuade people in that group to do something, first I got to start with listening. And I have to find out, what do they believe? How do they perceive the world? Where do they get their information from? Who do they listen to? And that's why I thought having spent the early part of my CDC career working in HIV/AIDS was such a great training ground. If you went into a situation believing you were the experts and you had the answers, it didn't go well. If you went into a situation and you came in leading with listening and trying to understand their environment, what the pressures they were facing, where HIV fit into their priorities, if at all, and you can talk to them about, what were their health concerns, you were a lot more successful. Conversely, I think one of the challenges with immunization when I first joined them was that it was the opposite. They believed that vaccines spoke for themselves and that they were inherently beneficial and that everybody would see that. And as a result, there was no need for communications.
Which we've recently realized is not the case.
Well, I think I realized it right away back in 1998. The reality is it wasn't vaccines that were speaking for themselves. It was the diseases that were speaking for vaccines. And so when measles is prevalent, when polio is prevalent, those diseases, through their visibility, through the harm that they're causing, are making a really strong case for vaccines. When those diseases pretty much disappear because vaccines are so effective, there is nothing really left to make the case for vaccines. So vaccines don't speak for themselves. And I think a lot of people got fooled into thinking they did. And as a result, there's been a long history of neglecting vaccine education, whether it's educating healthcare providers about what to say to patients or parents, or educating parents about why vaccines are recommended, why they're recommended for children at such an early age.
Yeah, I appreciate that point of view. When I teach immunology, when we get to the vaccine section, that's the first thing I do is I throw up a slide of someone with smallpox lesions on their face, right? So the public today has never seen that type of disease where you have such an outward presentation. And it really is true that the diseases speak for the vaccines. And it's a good point to talk about not putting the vaccines at the front, especially with vaccines like for influenza. We know as scientists that those vaccines are not necessarily the most efficacious vaccines, right? So how do you explain to the public that vaccines are important, not necessarily from keeping you from getting disease per se?
Well, I think, first of all, it's being honest about what the vaccine can do, right? And I think for influenza, for a long time, the messaging that many scientists and experts in medicine wanted to give was that if you get a flu vaccine, you won't get the flu. And I think they probably knew that there was a good chance you would get infected, but you probably wouldn't have symptoms. And so you wouldn't know that you were infected. Well, many people got vaccinated and then they got infected and they had symptoms. And then they felt like, well, the vaccine failed. I was not supposed to get ill. And I think what we have learned, and particularly with COVID vaccines, is that many vaccines are designed to prevent serious or severe illness. So you're going to get infected, and you're probably going to have, or you may have, mild symptoms. And that's a sign the vaccine is actually helping you, that you're not hospitalized, you're not knocked out for weeks. So I think being honest about what the vaccines can do. I think the other part of it is that most people don't realize that vaccines exist so that we can prevent things that we don't have good treatments for. So if you're infected with measles, or your child's infected with measles and it becomes very severe, there's no cure for measles per se. You're treating the symptoms. And I don't think most people realize that that's why vaccines exist, is you're trying to prevent diseases that are really hard to treat, and that even if you treat them, the treatments have side effects and adverse events. So I think there's been incomplete education about why we have vaccines and about the adverse reactions, side effects of treatments.
So speaking to your point about realistic expectations for protection afforded by a vaccine, I read that the CDC recently revised their messaging specifically around flu vaccines, something you were probably aware of. I don't know. Did you play a part in that? Or
no, I didn't play a part in that, but I did see, and I thought it was very pleased to see that. I thought that was a much better way to talk about flu vaccines, that they can prevent serious illness, and that wild to mild is a much better frame than telling people that if you get vaccinated, you won't get the flu.
Yeah.
So do you want to give a little bit more insight into, for our listeners who may not have seen that particular strategy, what that initiative is about, just if we can just talk about it real quick?
So the idea behind it, they've recently launched for this season a campaign that often that shows a lot of different wild animals and then relatively tame animals, and the tagline is from wild to mild. And the idea is that if you get your flu vaccination, or you get your child vaccinated against flu, that what you're really doing is you're reducing the likelihood of very severe flu illness. You're still susceptible to becoming infected, and it's still possible that you will get some symptoms, but you won't have very severe disease. And that's what the vaccine is designed to protect. And that's the same case for COVID. I mean, the COVID vaccines were designed not to prevent us from being infected, not to prevent mild illness, but to prevent people from ending up in the hospital or dying as a result of a COVID infection.
Yeah, breaking down this idea into some simple photographs or simple ideas, I really like that idea. Most of our audience is going to be scientists who are very familiar with how experiments are done in a lab setting and how we, test a hypothesis. Can you talk to us a little bit about how you test messaging and messaging approaches to figure out what is going to resonate maybe with an audience? Something like, how do they maybe determine that this wild to mild would be an interesting way of talking to the public about vaccines?
We did focus group research. Typically, we talked to healthcare providers, people who are in the front line, to get a sense of, what did they hear from patients? What questions did patients have when it came to vaccines? There was survey research, and in fact, I do survey research. We just finished a project where we talked to 1,280 U.S. adults about flu vaccine and about COVID vaccine. But typically, when I was director of communications, what would happen is in spring, we would be doing focus groups where we would bring people in, maybe 8 to 10 people into a room and have a conversation about flu vaccine, or about, if it was parents, about their concerns about childhood vaccines. I did that from the very beginning. In fact, the first groups I did when I joined CDC had to do with flu vaccine. And at that point, flu vaccine was recommended primarily for people 65 and older. And we did focus groups where we brought across the country, where we brought in people 65 and older who didn't get a flu vaccine. And that conversation focused on, well, why didn't you get a flu vaccine? And we heard repeatedly from those folks that a flu vaccine was for their mother. Now, these people were 65 to 70 some years old, and they were saying that it's not for me, it's for my mother. And we would probe and ask, well, why do you believe that? And they said, well, I'm healthy, I'm active, and your materials say if you're elderly and frail, get a flu vaccine. I'm not elderly and I'm not frail. And so it was really revealing. And we immediately pivoted. We realized that we had to purge elderly and frail, that nobody aspires to be elderly and frail.
Right.
It's not something, we want to live long, but we don't want to be elderly and frail. And we focused on the positive, that stay healthy and active. If you get a flu vaccination, it will help you do the things that you want to do. It'll help you stay healthy and active. And that's what you learn from doing communications research. You learn how your people in your target audience perceive your product, perceive your recommendation, and you also get a better understanding of what they value. And if you understand what they value, you can use that to shape your messaging.
And then do you follow that up around, at the end to kind of go back to see how effective that messaging is? So, you're basically, you've set up this strategy and you've used the focus groups to guide you, but then do you come back with a different group to see how effective it was, or the same folks or different people?
Not usually.
Okay.
What you're looking at typically is are you seeing increases in vaccination rates? And it doesn't happen instantly, and it isn't, profound. It takes a while for it to get out there and that to become part of the social norm and part of the broader thinking. The challenge is if you took and you came back and you grabbed some more people, you don't know if they saw the ads. You don't know if they saw the messages. And that's always the challenge in communications, is that the only way communications, you can get a sense of whether your messaging works, is if they saw the materials. And we're all bombarded with so many messages every day. It's just hard to know for sure that you actually saw a message.
Right.
So thinking about communication and scientists communicating, scientists typically communicate in very defined ways, often to an audience of other scientists, in which they present their evidence and then say, this is why I'm right, which I imagine could be frustrating. Do you ever work directly with scientists and have to explain to them, or do you get pushback from them? How frustrated are you with us?
That was my job for 14 years at CDC, was working with scientists and doctors to improve their communications. And absolutely I got pushback, but I pushed back too. And my position was that you're an expert in your science. I'm an expert in communications. And I've come to be an expert not just by studying it and researching it, but by being out in the field, talking to real people in the real settings in which they make health decisions. The discussions with scientists range from, you shouldn't use the word flu, you should use influenza, because influenza is much more accurate from a scientific point of view. And people in the real world use the word flu to refer to a variety of things, not all of which are respiratory illness. And that's absolutely true. But the other reality is that the media are going to use flu, people are going to use flu. You can't change that. Much as you may want them to use a more accurate term, they're not going to change that. So you just have to learn to adapt. I mean, you are giving up some precision. I get that. But if you don't give up that precision, they won't even listen to you at all. I think one of the other things that scientists often get in trouble with is they say that our recommendation is science-based. And I've often cringed when I hear that, because I think a much better frame is evidence-based. Mm-hmm. Because people, everyday people, we all use evidence. And we understand there are differences in the quality of evidence, that if a friend tells me I should do something, that's evidence, not high-quality evidence. If 20 friends tell me I should do something, well, now the quality of the evidence is better. But if you use science, I think, one, you're putting distance between you and lay people, because you're basically saying, I have training, you don't. Lay people also often assume, and we saw this with COVID, is that they're more likely to associate science with consensus and stability. And as we saw throughout COVID, that really doesn't define science. Science is, you're trying to achieve consensus, yes, But scientists disagree with each other on a daily basis about things that you would never believe that they would disagree about. And science is dynamic. It's constantly changing. Knowledge is evolving. And as it evolves, we make new or better recommendations.
Yeah, I think that's one of the hardest things for the public to understand and for us to convey as scientists is that it is changing. So the recommendations would certainly change.
And you have to get people to understand that if the changes are based on new evidence,
Right.
It's a good thing. That you're learning.
Right.
And learning is good. And we did that in the pandemic of 2009. I was the director of media relations, and I worked with Rich Besser and Ann Schuckett, who were the faces of that response. And they were really committed to constantly reminding journalists, constantly reminding people that our recommendations are going to change, and they're going to change because we have new evidence, we've learned things, and we need to take advantage of that new knowledge.
I remember that. That was pretty fast moving from the identification of this potential swine flu to evolving as it went. So you must have been pretty busy.
Yes, we did a press conference every single day for 8 weeks at the beginning, including on weekends. But we went into every engagement with the media knowing our purpose. We knew what we were trying to achieve with our communications. One of the things that I was a fervent supporter of was that if we were going to do any kind of press conference, press event, we had to know going in what headlines we were trying to achieve. And we would spend a lot of time preparing, trying to identify if this works, what headlines would we expect to see in the media? What would the stories be focused on? And we weren't ready to talk with media until we knew what we were trying to achieve. And that was a really helpful exercise. And when we didn't have it, it didn't go well.
It's a nice approach, and I think it was a very good and strategic one for sure. We talked about how science is not dynamic, right? So it's constantly changing, but it's also not black and white, which I also think is something that can be a misconception. It's not ever an all or nothing, and circumstances and people are very different. How do you determine how much information or scientific details to share with the public in terms of, covering different nuances and different things, right? Because people, I know, like if I go, for example, out into the public and people find out I'm an immunologist, they immediately start asking me like, well, should I get the new COVID vaccine? Should I do this, right? Well, my doctor said this and my doctor said that and I have this and I have that. So, when you're trying to make recommendations, right, in a more general way, but there are, certain differences in certain, details where things may not be the same recommendation, like how do you carve that path of how you're going to communicate something?
Well, again, it goes back to you probably aren't going to try to communicate to the broad public because you're right. People have different needs, different interests. The recommendation is probably going to vary depending on whether they have certain health conditions or not. And so for a lot of medical recommendations, what you have to really first and foremost do is prepare healthcare providers. Doctors and nurses have to be really well equipped to know what the nuances are, how to talk about those nuances, and who to talk about those nuances to. It's really hard to use mass media and other channels to just try to talk to very specific groups of people. Commercial marketers have a great advantage. They have money. Most government agencies don't have budgets to do a lot of communications. I mean, you can't buy a lot of media time and a lot of space to make sure your messages show up in the places you want them to show up. So what you're really doing is you're working through who are these people, who are they going to turn to for medical advice or for medical treatments or for vaccination. And we have to equip them to be really smart about how they communicate with patients. And we have to communicate them to know what the nuances are. Because trying to educate the public about that, it's a fallacy that the public is that interested that they want to become, an expert in your topic area.
Mm-hmm.
So realizing that scientists are not professional communicators, is there things we can do to become better? Do you have any advice for scientists?
Well, I think one of the first things is to put more emphasis on listening and asking questions to learn, what the understanding that the person or the audience you're talking to has about your issue. I think learning how to talk in more common words and examples. And I think a good example of that, and I don't see a lot of this, but I've come to realize that, I think everybody is an expert in their daily lives, whether you're a scientist or you're an auto mechanic. And I think if you're talking to an audience of blue-collar workers, every day they have seen over the course of their careers changes in technology, changes in what they have to do in their workplace, and trying to use that as a basis to say, if you're a car painter, the technology has changed, right? I mean, you're not using the same technology you were 20 years ago, right? And some technologies have worked better than others. And how do you make your decisions? Don't you look at evidence? I mean, trying to find ways where you can find common ground in terms of explaining what you want them to understand and using examples that they can relate to, I think, goes a long way.
I'm going to follow this discussion up with asking you your opinion on the responsibility of scientists to engage the public. Do you think it's part of what we need to do? Do you think scientists need more training? If so, when do you think we should start training scientists in terms of communication? Or do you think that the better approach to engaging the public about science is to have people who are trained communicators like you are, who then specialize in some way in science?
I think scientists have to be at the forefront. I mean, I can help, and they should get communications training, and they should use communications professionals, absolutely. But if scientists aren't involved and engaged and at the forefront, well, then who actually represents the scientist? Mm-hmm. I don't think you want surrogates typically representing you. It doesn't go well. And I think, some of the issues that we struggle with today in terms of people not trusting science is because scientists haven't been as visible and they haven't been out there as much and they haven't been as communicating as well as they could be. And it all takes work. I think I tell my students this all the time. Most people think communications is easy to do because we all talk every day. Most people mistake providing information with communications because we use the word communicate. I want to communicate to you, which is just basically, I'm just going to give you some information and hopefully you'll take it and read it and understand it and do what I want you to do. Whereas communications is dialogue. Communications is trying to find common ground. It's a give and take. It takes place over time. It doesn't happen instantly. You have to constantly be in the game. I think one of the things I noticed early on when I was at CDC is that a lot of scientists and doctors have kind of a pill model based on their training, where if you have a problem, I give you a pill, you take the pill, the problem's solved, and you go off the pill. And they think communications works the same way. No, communications is you're in it day in, day out, constantly over time. McDonald's doesn't stop advertising, even though we all know what McDonald's does. Mm-hmm. Burger King doesn't stop advertising, even though we all know what they do. And I think that has never been part of the scientific culture or the public health culture, is that communications is got to be part of your daily routine, and reaching audiences and talking to people has got to be part of what you do every single day.
And I think maybe the pushback that you probably get from scientists is the time aspect, right? So, we have a lot of responsibilities in the lab and teaching, for example, at UGA. So, finding the time, I think, is the hardest part. So how do you encourage scientists to give them, I know this is all going to have to be edited.
There's a couple of things. One, you have to decide, you can't have it both ways. You can't say that people are not knowledgeable about science and we need to make that a higher priority, and then you yourself not make it a high priority. So you can't say it's important, but then not.
Right.
Your actions have to be consistent with your words. Right. So that's one thing. And then you also have to understand that the same challenges facing you are the same challenges facing your potential audience. And so you're saying, I'm really busy, I don't have the time. Well, guess what? The people you're trying to communicate are in the same boat. They are busy. They have lives. They're not waiting for the latest piece of information from anybody. And so it is something that you have to be engaged with. And if you look at the people who are causing challenges for science, they're fully invested and they're fully committed. And if they're fully invested and fully committed, they're going to make more progress, bigger gains than you are. If you're going to do it haphazardly, not systematically, and part-time, well, then you shouldn't have high expectations for success.
So I think maybe we'll close off with one question I have, and we're getting back to vaccines, because recently I had my yearly physical and, checkup and stuff, and was recommended to get, of course, the COVID booster, seasonal flu shot, and now RSV. And, my doctor just told me these things. Is there a risk that the public's going to get a little vaccine fatigued? Because it used to be just the flu in the fall. Go get your flu shot. And now we're up to 3 things. So,
well, again, it all depends. I mean, like in childhood vaccination, 75-80% of parents get their children vaccinated on schedule and don't see vaccines as a really big deal. And I think sometimes we get fooled by the stories you see in media and things you see on social media, because those are the people who are the most interested and have the loudest objections. I think, again, it gets back to, it all depends on how healthcare providers, doctors and nurses, and often nurses are the ones who get the vaccine, how well they communicate with people about what those vaccines are and why it's important to get them.
Our guest today is Glen Nowak from the Grady College of Journalism. Glen, thanks for being with us.
Thank you.
Links to additional information about Dr. Nowak's research can be found on our Instagram account at PPP Podcast UGA. That's triple P Podcast UGA, all one word.
Thank you for tuning in today. If you have any questions or suggestions for future episodes, reach out to us via email at ppp@uga.edu.
This podcast is brought to you by the Faculty of Infectious Diseases and the Grady College of Journalism at the University of Georgia. It is supported by the University of Georgia through the Office of Research, the UGA Graduate School, and the College of Veterinary Medicine. Thanks to the New Media Institute at Grady for use of their Studio Not Found podcast facilities.
And that's a wrap.